maybe staying on the antibody drug conjugates. So we had two questions related to the HER2 low settings. One is, what do patients need to know about being HER2 low and new therapies we should be asking our oncologist? And then more specifically, a question on Enhertu, which is, can you weigh in on how effective Enhertu is in HER2 low and how well is it being tolerated?
Yeah, really good question. So I think one, what does HER2 low mean? We've always thought of breast cancers as being HER2 positive or HER2 negative, and what's this HER2 low business? And in essence, it's a term we kind of made up because we noticed that these antibody drug conjugates work by targeting that protein on the cell surface. So even if your cancer is not HER2 positive, so not strongly has a ton of HER2 protein, what if you have a little bit of that protein? You can use it as an anchor to deliver the chemo. And so it is important to realize, even if you have a little bit of that HER2 there. And so what we mean by saying someone's HER2 low is it means their tumor is not truly HER2 positive. It's not completely HER2 zero, meaning it doesn't have nothing there. It does have something there. So it's in between. So it has 1+ or 2+ staining for that HER2 receptor. So there's a little bit of protein on the surface. And what we found is this drug, trastuzumab deruxtecan, not only works in the true HER2 positive patients, but also uses that HER2 and HER2 low positive patients to deliver the chemo. And where we did see that it had significant benefits compared to standard chemotherapy. So I think the key message is to know if you have metastatic breast cancer, even if you're HER2 negative, is your tumor HER2 low? So your oncologist should be able to give you that information. And if so, is trastuzumab deruxtecan a good drug for you? We don't like to use it in people who have a history of pneumonitis induced by a drug in the past, because we do worry about this drug then inducing, interstitial lung disease. Because again, there were a couple deaths seen with this drug. We do have to be very careful in selecting people and making sure they don't have a contraindication by having had prior pneumonitis. But outside of that, most people are candidates, and it is a good